The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons. Today's show, we'll be talking about Medicare, particularly about 2024. There's some changes in Medicare that's coming down the pike, and you have the opportunity to evaluate your Medicare plan and possibly your Part C Advantage plan. How is meeting your needs over 2023? October 15th to December 7th, you have a decision to make, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. As I mentioned, that 2024 is coming up pretty soon. I know you hate to think about that, but Medicare has an open enrollment plan from October 15th through December 7th. That gives you time to evaluate the Medicare plan you're on and maybe the Part C or Advantage plan that you're on. And we'll be talking about how to evaluate what's going on with your plan. Is it meeting your needs? Maybe you need to change it a bit. Of course, we have a wonderful guest that knows all about this. We have Renee Labrie-Shanks. You're the SMP Director for SHIP in state of Montana. Welcome to the show. It's great to have you here.
Thanks, Brian. Thanks for having me.
Great. Well, let's start at the top. A lot of people have heard the word Medicare, but they might not be sure what it is. And actually, there's some A, B, C, Ds of Medicare. Please define those for me and tell them what's important about each of them.
Sure. Medicare, I think people get a little mixed up between Medicare and Medicaid. Medicare is the federal system of health insurance for folks who are over 65 and certain people with a disability. So first of all, when you turn 65, that's when Medicare comes on scene. So I will talk about the A, B, C, and D of Medicare. There's some, I like to draw a football diagram when I'm helping people look at the big picture. But how people get on Medicare is, they need to start thinking about before they turn 65. They can come in and talk to a SHIP counselor somewhere between, 6 months before they're turning 65, so they can kind of get a grasp on all of the pieces and parts. And then they want to check with their doctors to see if they accept Medicare or if they accept Medicare Advantage plans, get kind of a coverage knowledge base going. And then they'll enroll about 3 months before their 65th birthday. They can enroll in Part A and B. If they are already receiving Social Security, they will automatically be enrolled. And then they can I mean, there's so many pieces and part to this that we have Medicare 101 classes across the state because it's just a lot of information. To do an overview like this, I want people to make sure that if they need to, they can go to their area agency on aging and get a one-on-one consult to really go over their situation.
Mm-hmm. And then we were looking at Medicare. It's a health insurance program that you're entitled to if you have, I think, 10 quarters of Social Security coverage, and you have Social Security. They'll deduct the premium out of that directly, but you have to apply for it. But now let's talk about Medicare itself, the ABCDs. What does A, B, C, and D cover?
Sure.
What's optional, maybe?
Yeah, well, Medicare A is for doctors, hospital coverage. So people, it's actually 10 years or 40 quarters that they've worked and paid into the system, they'll qualify. And so the premium for A is paid for, basically. So that people should definitely take. And then if they're still working, their insurance can be everything else at that time. B is for doctors and lab tests, things like that. And that is technically optional if you're still working and you have coverage. Otherwise, you want to get that if you're also retired and going on Medicare. So you get the A for hospital coverage, B for doctor coverage, and that's known as traditional Medicare. And that covers 80% of your healthcare costs, minus a deductible every year for, different services. Your Part B has its own deductible and your Part A does as well. And that covers 80%. So if you just had what's called traditional Medicare, you've got 80% of your covered benefits taken care of. And so that's where you say, there are missing pieces. You would either get a supplement plan, which fills in that gap, that 20%. And those are sold by insurance companies. You go to a local community, walk in a door and talk to an insurance agent. And then there's something called Medicare Advantage plans. And I don't want to get too confusing, but Medicare Advantage plans, if you don't have a supplement plan to fill in that gap, you would want to look at maybe Medicare Advantage plans because those have a more broad coverage, but you're still going to pay a lot of co-pays for services through that. And that's where really sitting down with a counselor and talking about your unique needs will really make this clear. But so you got A, B, traditional Medicare, and then you've got a kind of a gap there where you fill it in with a supplement, or you look at Part C Medicare is what it's called now, the Medicare Advantage plans. And then you get a D, Medicare Part D, and that's for drugs. So that's easy to remember. And everybody needs a Part D drug plan. If they wait to get one down the road when they need it, say they're not on anything when they turn 65, and then when they're 75, suddenly they're on a slew of drugs, they're going to pay a premium, and it's 10%. It adds up it's 1%, per month for the national average of the premium for every month they didn't have it that they could have, which can get up there. I've seen it, $20 or more.
Mm-hmm. Well, now, we kind of mentioned that if you're still working, and that's a big consideration because things can change in Medicare. But if you're not working, if you're retired, it's a lot simpler, the ABCDs that you described. But I think in the next segment we'll need to talk about if you're working, because that's a little more complicated. But it's important that you apply within the time frame. Tell us that time frame again quickly.
Sure. When you are signing up for Medicare to begin with, you need to sign up within, it's somewhere around 6 months of your 65th birthday. It's the 3 months before, the month of, and then the 3 months after. And if you don't do that, there are general open enrollment periods. But that's when the key is, because I want to say the clock starts ticking on being able to sign up for a supplement plan once you go on Medicare. And once you pass that period of time, you may not get coverage for a supplement because there's they can look at pre-existing and guaranteed issue rights. And all of that.
Renee, let's talk about that in our next segment, which is coming up in just a moment. Stay tuned.
Can you say ombudsman?
Ombudsman.
Benson? Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman! I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're talking about Medicare, the ABCDs of it. And in the last segment, we basically defined that, but there's a little bit of a consideration there if you're still working when you become eligible for Medicare. You still want to sign up for Medicare, but you want to figure out what is your best plan. And we have SHIP counselors statewide that can help you. We'll have an 800 number on here for that. But Renee, what are some of the considerations that an individual wants to think about once they enroll for Medicare and they're covered by their employer's insurance?
Yeah, they definitely want to talk to their benefits administrator. They want to find out how that works with Medicare, because it depends on how many employees are employed at their agency. It depends on if they have creditable coverage or not. So when we get into those details, basically they just need to remember you go on A, that's premium free for the person. And then if they have those benefits through work, they'll basically carve out those benefits that Part A will cover. So your premium should go down with your work. And that would fill in what you need for as far as supplement and Part B and D. So you don't have to worry about that if your plan covers that. If it doesn't, you may have to go on your Medicare Part B, which is the doctor coverage, and then they become your supplement basically to fill in that gap until you do retire. And then we talk about D again. It all comes down to creditable coverage, which means does their plan cover as good as or better what Medicare does? And if it does, they just need to get a letter from their benefit administrator and put that in a nice, safe place until they need it, that just says it has credible coverage. If it doesn't, they'll need to choose a Part D plan as well, which is separate from traditional Medicare.
Okay. Now, when you talk about one insurance plan, if anybody's dealing with insurance at all, it's like, now you got two plans and they need to work together. And you have the employer's people, they'll tell you what works and what you believe might work in Medicare. But we have people to help you, don't we? And they're statewide. They can sit down and they can help you determine what maybe you need to pay between the two, or what plan might be better for you. Tell us more about our SHIP counselors.
Yeah, they're located in every area agency on aging and county council on aging. And then they're also located at various different hospitals and tribal entities as well. And SHIP counselors know Medicare benefits and enrollment. So they're a good, unbiased, free, confidential resource to go through that is not going to get paid to sign you up for a plan. Their job is to educate you and inform you and give you all the information so you can make that choice for yourself. And now they can help enroll you in a Part D or Medicare Advantage plan that they can help you do. They can help you understand how to enroll in Medicare. They don't enroll you themselves in Medicare. And then the same with the supplement plan. They can let you know all the different supplement plans, what they cover, and give you a guide that our Commissioner of Securities and Insurance Office puts out for us that gives people the knowledge on choosing a plan. And then they go to an agent and sign up on their own for that as well. And again, going through their benefit administrator, they know how Medicare works with their benefits and whether they need to add or drop coverage at that time and when to do it.
Okay, and they will help you. The plan administrator, our SHIP people will do that. But now we have what we call an open enrollment period every year, October 15th through December 7th. What is the open enrollment? I mean, what changes that we want to reevaluate our plans?
Yeah, that's specific to Medicare drug plans and Medicare Advantage plans, where you can sign up for a plan, you can change a plan, you can switch from Medicare Advantage back to traditional Medicare or vice versa. So you can do a lot of things during that period of time. And that 7 weeks is so important because it's going to affect your entire next year. If December 16th rolls around and you haven't made a change, you're basically in whatever plan you're in from this year. And what we've seen is these plans make changes. You know, they add and drop drugs to the formularies. They may have doctors that join or leave their networks. And that's really critical. If somebody's doctors are leaving their plan's network, hopefully the doctor's office are letting them know ahead of time. But they need to make sure they've got a plan that has the doctors that they need to see in them. And so coming into the SHIP counselor, they can get you on, or you can go by yourself to Medicare.gov. And that has the plan finder where it'll ask you some questions so it knows it's you. It's basically your own Medicare.gov account. And then it'll compare plans in your area. And it's specific to your county or your region because the plans are very regional. So somebody living in South Dakota can't just join the same plan you did in Glendive, Montana. So anyway, you go on there, or the SHIP counselor will guide you and show you all of the options, and you can sign up for a plan or again change your plan during that period.
Okay, so it's important, Medicare.gov. You need a password to get in, and you have your entire year's worth of medical information and what's been billed, and you have some options as to what you might want to choose next year for your Medicare open enrollment period. And that period seems to go by pretty quick every year, so get on it early. But we have SHIP counselors with the 800 number here that can help you through that process, right?
Yes.
Okay.
And if you're standing by, I would recommend calling now if you haven't already to get an appointment.
Yeah, call early because they can help define the plan that you're on. Well, but you give them the information. But I think what's really important is they don't have anything on the shelf to sell you. They have no financial interest in your decision, and it's your decision. They will assist you in answering your question and help you choose the right plan that you feel is appropriate for you. And what's important, your loved ones can help you too. If this is all pretty confusing, you know, if you have a spouse or a child that can help you, ask them to help. We'll be right back. You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and continue our discussion about Medicare. And guess what? A whole new year's coming up, January 1st. So Medicare is changing a bit to better meet your needs. And of course, we've got a wonderful expert on this. We have Renee Labrie-Shanks, and you're the SHIP counselor. You help people statewide. But what are some of the changes that are coming up in 2024 that we can look forward to?
Yeah, and one of them started at the end of or the beginning of this year, and it's going on, and that's the capping a month supply of every covered insulin, and it'll only be $35 now. And that will be on the person who chooses a drug plan. They need to make sure that that insulin will be $35 on that drug plan. Doesn't mean every drug plan will cover every insulin, if that makes sense. So they need to look out for that. Also, recommended vaccines are now available at no cost. People used to have a cost share with that, which could be $200. So that's a huge deal. And then they are eliminating the catastrophic coverage or cost sharing, where it used to be once you've spent a certain amount out of pocket, you would spend only 5% from there on. And now you'll pay nothing if you reach that. And then they're also capping annual out-of-pocket drug costs for prescription drugs. And this will all show up on the plan finder when you've got yourself entered in there and your drugs. All of this will show in there and will give you guidance as to what drug plan to choose.
Okay, and that's, I think it's important to note too that you'll be receiving, all the Medicare beneficiaries, Medicare and You shortly. It's a booklet about all the Medicare conditions and benefits that's available, and it's pretty easy to read. Go through it. I mean, you get familiar with the terminology and what's going on to be informed. And then if you have any questions above that or need any assistance, just call your SHIP person. If you have any questions, they're there to help you. The open enrollment is October 15th through December 7th, and you'd rather have an individual call early, right?
Yes, call early to get in your local area, because spots do fill up this time of year.
Yeah, and there's no extensions, anything like that. So, and if you don't make a decision on maybe changing your plan or anything, you stay in the plan you had the prior year, which might still be appropriate for you. But what are some of the considerations a person might want to think about? Is the plan meeting my needs right now? How do you define that?
Usually what they look at is the cost and then restrictions. And those will be pretty evident because when you pull it up on the plan finder, it'll automatically show you the top plans in order of cost. So it'll have your plan at the top regardless. It'll show that. And then if your plan is also the lowest cost plan for you, and that includes premium and all of the other, co-pays or co-insurance, that'll be the top plan there. So it could be your plan still, or it could be another plan, and that'll show you. It'll be very clear. And you can look at that. And then you want to look at restrictions. Are they placing a quantity limit on a drug that you need a lot of? Or do they have a like somebody needs pre-approval for a drug that works for you and you don't want to go through that process? So these are things you can talk to the SHIP counselor about. And those will be in the details on the plans that are showing up. And you can see the entire year mapped out for you with the costs of every month. So it would show you exactly what you're expected to pay if you're on all of the drugs entered that day for the remainder of the year. And there'll be no surprises that way. And if, like I said, that insulin, if you're on a plan now that doesn't cover that insulin that you're on for $35, that may make a huge difference in the next year and why a plan may be there all of a sudden that wasn't last year. So changes happen. But then again, like you said before, your plan may just be the good plan for you too. So
okay. Now, many times there's individuals throughout the state, they need a little help, a little extra help covering some of the deductibles or the costs of various insurance. Now, we have some extra help programs that are available. I recommend people call your SHIP counselor, but tell us about those different plans and how they can assist.
Yeah, that's a great one because there are some changes with that as well coming into the next year. There's a low income subsidy, and that helps people pay premiums and their cost share of the prescription drugs themselves. So they get the Medicare Advantage or the Medicare Part D plan, and then this low income subsidy comes in and pays their premium or partial premium, and then helps with the coverage of the actual drugs. So they'll have a co-pays basically. And what's changing is the folks who had a partial subsidy where it paid part of their premium last year will now have full coverage for that. So that'll be an automatic thing that happens for folks already on it. And if people think they might qualify based on their income, maybe they wouldn't know exactly where they fit with 150% of the poverty level or something, but will be something evident to a SHIP counselor that can help guide them. And then there's also the Big Sky RX. That is a Montana specific subsidy, and it's paid for by tobacco tax increase several years ago, and they've dedicated it to help pay seniors premiums on the Medicare drug plans. So if people don't qualify for the low income subsidy, maybe their income's a little higher and they still qualify because they have to have a certain income level, but it doesn't look at resources. So maybe somebody has more resources but a very low income, they could qualify for that Big Sky RX, and it would pay their monthly Part D drug premium.
Well, that's great. Well, now we're quickly drawn to a close on the show. And Renee, I'd like to thank you so much for what you do for all Montana citizens and for your state service. Thank you for doing that. And we appreciate having you on the show. And for our viewers, as a quick recap, we're talking about Medicare. There's A, B, C, D that are out there. If you are eligible for Medicare, you have a window in which to evaluate your plan, October 15th through December 7th. If you need some assistance with that, we have SHIP counselors throughout the state that can help you. And we have some programs that can help you pay some of those deductibles or their fees. If you recall a SHIP counselor, they'll help you through that maze of eligibility, and they want to help you. They're there. They want you to get what the benefits you deserve and what you need. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.